People ask me all the time, what is addiction? And I always fall back on the example of cigarette smoking. It's the most prevalent addiction in our society. You see it all the time, and most people have either smoked themselves or currently are dependent on cigarettes or know people in their family that have had experience. So once you start thinking about addiction from the point of view of tobacco, it's very easy to think of it as a habit, as something that people are doing frequently, and often using a substance to make them feel better. So in the case of cigarettes, you smoke because you're feeling cravings, you're feeling withdrawal symptoms from a lowering of nicotine in your bloodstream, and you're replacing that by lighting up. So that example, I think, serves us well, because if we then start to move into areas where we're less familiar, if we think about, for example, heroin or cocaine, the drugs that we treat in the NHS, well, those may be, kind of unusual substances, but the same processes apply. A person is taking that drug to avoid feeling withdrawal symptoms. Yes, to get high. Yes, to change mood. Yes, to relax. Yes, to celebrate. Yes, to forget. All of those things. But fundamentally because they have a strong drive to take the substance, a compulsion. If you think about how common addiction is in the UK, then look, just pull back and visualize the entire globe, okay? Start from that position. What you'll see when you look around the world is 2 billion people drinking alcohol. That's 40% of the global population. 1.3 billion of the global population smoke cigarettes. That's 25%. So they dominate the sort of addiction scene. And the drugs that we really worry about in the NHS punch above their weight, but they're numerically much smaller. So, for example, globally, about 200 million people smoke cannabis. About 85 million people take amphetamine-type stimulants. And then we're narrowing down. It's just 20 million people globally that take heroin and cocaine. Now, in our country, that's about 300,000 people with a problematic, serious drug problem, 4/5 of which relate to heroin and cocaine. And on any given day, literally as we're sitting here today talking, there are about 135,000 people in treatment. So we've gone from the big to the small. But as we drill down, the problems that patients with heroin and cocaine dependence experience are really persistent, very nasty and enduring. And they affect the health of the individual, the family and the sort of social context in which a person lives. And they place huge cost burdens on us in society.